Welcome guys for another session of constructing custom special trays, which is DLT DEN002 and which comes under DLT 35115 Certificate 3 in Dental Laboratory Assisting Release 4. So the second one was the training package under which this component comes. So join me to acknowledge, give the acknowledgement of the country. I acknowledge the First Nation people, elders, leaders and of all ages as traditional custodians and keepers of the culture and spiritual connection to the land, water and skies of Dark Indian country. I also acknowledge and pay respects to the Aboriginal and Torres Strait people. So let's do a safety brief. Here is a safety inspection report as well. So I'm going to, because we have changed the venue, we are in block A. So the exit is behind the camera. That's where we came in from. There are toilets just behind me. Be mindful of the wires and furniture around you. Keep your phones on silent. In case of any emergency, please follow me and I'll take you to a safe zone. Also, keep it as a safe learning space, so respect each other. And in case of any allergy to material which we are going to use, please inform me ASAP so I can get your first aid. So for PPE, we have eye protection, we have gloves, mask, and the material we are going to use is a light cure based material. So that's why we must wear gloves while we are manipulating it. I have sharps also here, so be careful when I hand it over to you and be careful using the sharps. Okay, learning objectives. Learning objectives are reading and interpreting a work order, preparing the model, selecting and preparing material to prepare a special tray, and constructing a special tray, and finally finishing a custom tray. The structure of the session would be, we'll talk about work order, we'll talk about designing of custom tray for edentulous maxillary model. This is an edentulous maxillary model. Choice of material and processing. There will be a video file to show you how it's done. Also it can be used as a review video. We'll do a demonstration. I'll do a demonstration and then we all together make a special tray each on a maxillary edentulous model. Then we'll finish the impression tray or the custom tray on the model, and we'll again review the video. We'll get to learner's outcome, and in the end we'll get a feedback from you guys. So learner's outcome will be, learners will be able to correctly read and interpret work order, design and fabricate an impression tray, and finish a custom tray according to the work order. Now, first impression is the last impression. Why this picture is there is it shows that there was too much material in that tray and the impression has extended all the way to the throat. So the reason is, when we're using stock trays, they don't fit all humans equally. They are just made in 3 basic sizes, small, medium and large, and most of the time people are either bigger than the larger tray or in the middle of small and the large or the medium. So if we have to modify the tray and try to get impression as close as possible to the human anatomy, in which case we normally fail with our primary impressions. So to get a good secondary model or a cast, we make a special tray, which is also called a custom tray. So any experience with special impressions or primary impressions, extensions? Anybody wants to share anything?
Never seen an impression like that. Never had that problem. But yeah, sometimes you have to modify the tray to fit according to the person's job, depending on like it can be narrow at the front to wide at the back. So
So what is a work order? So before we start, I would ask you to sign in the attendance form for me. Thank you. Now I have given you a work order form. Now work order form is a legal document in which there's information of the dentist from whom the work is come from and about the patient. It also contains a job description which tells us what the dentist wants from us, and details of when the work is due. So there's a date on which the job was sent and a due date, right? So if you, with your pen, if you can tell me what is the name of the dentist? Yes. So that's the surgery and the doctor's name, Dr. Dunhill. Can you mark it with me, please? Yes. And can you tell me what is patient's name?
Robertson Jeff.
Yes, Jeff. So Robertson Jeff. All right. And can you tell me when the job is due?
5th of May.
Yes. And can you please read on the job description what the dentist wants us to do? Can you read it for us, Sindhu?
Please construct
A bit louder.
Please construct a custom tray with handle for a given edentulous maxillary model. Choice of impression material, rubber base, so do not use spacer. Keep the tray borders 2 mm short of sulcus interiorly and buccally. Full coverage from one hemular notch to another, crossing fovea palatable.
All right. So it's quite straightforward, but for a new person, it may sound very difficult or different because a lot of words are scientific or anatomic words. So what this person wants, or the dentist wants us to do is to fabricate or make a special tray on edentulous maxillary models. Now when you turn these models, you will see on the base of the model there are three important information. One is name of the surgery, name of the dentist, name of the patient, right? So you know that this model is for this job order. You don't mix unless you mix the jobs,
Yes.
right? So you can choose each model whichever color you like. Okay. So they all have the same information at the back. Are they the right models for the job?
Yes.
So we have identified the right model for the job. Now it also tells us that type of impression the person is going to use. He's going to use a rubber base impression. So for a rubber base impression, we normally don't have any spacers in between, because if we put a spacer, the impression material will get thicker, and when you record the impression, it won't give proper pressure or compression on the soft tissues, right? So the dentist has made it easy for us to choose or design a tray. Also, it says it should be 2 mm above the sulcus. So what is a sulcus? So if you hold a pencil, you can take a pencil, yeah, please go ahead. Draw a line in the deepest part of the sulcus like so. Okay. All around, and where these attachments are, just go above it. Don't go all the way up, just above it. See? Just I'm keeping the contact with it. Okay? And draw a line all around in that area. Okay. Now at the back, so there are maxillary tuberosities here. We need our impression tray to cover these tuberosities. Tuberosity is a bony hill at the back of the impression. Right? So at the back, on the model or the impression model, sometimes there are two little depressions seen. they are mostly on either side of the midline of the whole impression, basically. They are like this. These two dots are called fovea palatine. This marks the junction of hard palate, which is the palate roof of the mouth, and the soft palate, which forms the epiglottis image. Yeah. Now, there. So you can put a line through, going straight in the middle. Now the posterior part of the tray extends straight out along the most distal extension. It is not curved inwards. Yes? So it just goes straight like that, from one hamular notch to another hamular notch. Sometimes it crosses over fovea palatine, or sometimes it's behind, depending upon how deep or shallow the palate is. Once that is done, now keep the tray borders 2 mm short of the sulcus in anterior and buccal. Yeah?
Yep.
So what the doctor wants is, these are the buccal sulcus and these are the labial sulcus. So the dentist wants us to design a tray that finishes 2 mm above the sulcus. So like this. Yes, very good. So 2 mm does not mean that you have to measure it with a scale or a caliper. It means approximately 2 mm. So if it goes 3 mm, it is still fine, because the material has that consistency to hold its shape. Now at the back, this bit, we don't keep it short, we keep it exactly at the same line. Right? So we will not draw anything at the back, we will leave the line like this. Yes? So on the frenums, you have to give enough relief. Yes? The idea is, when the tray is inserted in the patient's mouth, it should not hurt the patient. If the tray hurts the patient, then the impression will be wrong, because the patient will move when the pressure is applied. Yes? Can I have a look at your drawings? You can have a look at mine. Very nice. Okay. The model and tray design. What we have drawn on the model is called model and tray design. Now, why do we construct special custom trays or impression trays? Is one, it fits the patient better than a stock tray. Right? And second, it allows a homogeneous mix. So if I am going to do an impression with this, there's a big gap at the back. It doesn't fit the patient's mouth. So when I'm going to load the tray and take an impression, it will be very inconsistent, and there would be areas of thick borders and shallow borders, which would be areas of pressure and relief, and I won't get a nice fit. So I must design a tray that fits the patient nicely all around, and when the dentist takes the impression, it is all even all around. Yes? So it also provides, since it is going to fit nicely, it would be much more accurate. Yes? Also, it prevents wastage of material, so the dentist doesn't have to mix and go, oh, it doesn't, I went less or more, and now, just like that previous picture, the material had flown all around. So with this, the material stays in the tray, doesn't flow out too much, and it makes the thing economic. Anything you want to add or ask? No? Okay. You need to move a little forward, you might be out of the camera. Yes. So things we need to prepare this in custom impression tray is Personal protective equipment, that is eyewear if you want to. Don't look into the light because that's a UV light. Mask and gloves, small and medium. There are pencils to design the tray that we have used. Light cure machine, which is these two boxes, and light cure material, which is in this box. Now it is supplied in a black opaque box so that the material does not set with sunlight or white light. And spatula and instruments, so to adapt or to cut, yes, or to finish.
The impression is poured with type 2 dental stone, and the cast is allowed to dry out completely to prepare for the fabrication of the custom tray. Mark the outline of the maxillary denture bearing area. Using a pencil, draw a line that passes in the full depth of the sulcus anteriorly. The distal end of the maxillary denture is marked using a line that passes between the two hamular notches distal to the maxillary tuberosities posteriorly.
Okay.
Next, draw a second line that is 2 mm away from the depth of the sulcus.
This one.
This is to leave room for the tracing compound during border molding. Now, note that the two lines meet at the distal end of the denture bearing area.
So this is the distal end of the denture bearing area.
Get a sheet of light cured acrylic and adapt it to the surface of the cast, starting from the center in an outward direction. Fold the material gently into the full depth of the sulcus to make sure that the sheet is closely adapted to the surface of the cast and air is not trapped beneath the surface.
Watch the video first.
Use a sharp lacron carver to trim away excess material according to the second line you drew earlier, the one that's 2 mm away from the depth of the sulcus, as you're going to provide enough space for the tracing compound material to border mold the peripheries of the denture bearing area. And make sure that you provide enough space for the frenum and that you follow the anatomy of the denture bearing area.
So see, after removing the excess, now the person is removing the material to the line.
Now to make the tray handle, collect all the excess material and shape it into a cylinder. From one end, cut halfway and shape the material with your fingertips. Place it over the tray in the midline and adapt it to the base of the tray. Make sure that the handle is set at around 90 degrees so that it does not interfere with the lip while making the impression, and that the top third of the tray should be slightly curved to allow the dentist to hold the tray while making the impression.
Okay. So from there,
Place the tray in the light chamber for 3 minutes to cure.
so depending upon the material, some materials set at 3 minutes, some at 30 seconds, and some in 1 minute, depending upon the
Remove the
strength of
tray
the
from the
lamp.
cast
It cures at
and cure it on the fitting surface for an additional minute.
So once it is cured from outside, it is removed and placed back in the.
So it doesn't stick to the.
No, it will not stick to the model.
Once the
Okay.
place the tray in the light chamber.
So this is the basics. Now I'll show it to you how it is done. I will wear gloves. I would ask you to wear gloves too. Now those are too small. You can as well. Thank you. Okay. Once you're ready,
Do you watch first?
yes, you watch me first.
How much time do you have to work with this material?
Well, the working time of this material is around a minute, and by the end of minute the material starts to harden and then it will go into full set. So idea is to do it at a consistent pace, not do it fast and slow and fast and slow. Be consistent while you're starting to adapt. I will show you how it is done. Okay, so it comes as a blank. It has a wider portion and a narrower portion, just like a model. So we'll adapt the wider portion at the back, and then gently from one side, I'll go in the middle, going from back to front, and like that. I'll keep on adapting from one side to the other. Yes. Now, because we have a very humid weather, sometimes it becomes sticky to the gloves. So be mindful of that. The idea is once you've adapted, it should not lift up. Yeah. So you hold and support and gently push it in. Yes. I'll use a X-Acto knife to remove the excess on the land area. I'm not cutting like this, I'm cutting like that. Yeah. I'll resheath the blade and remove all the excess. I'll put the excess back in the box and again adapt it a little bit more to make sure that it's sitting in its place. Now I'll cut it 2 millimeters short of the vestibule. Like so. Yes. But at the back, I'll leave the vestibule, the posterior extension of the tray exactly where it is, right at the last border. Right? So once this is done, I will use some extra material which I have removed from the side. I'll roll it in my hand quickly and make a cylinder. I'll make a flat shape with it. So it's like a little rectangle with a wider base at one end. I will make a little cut on this. So idea is to split it evenly on both sides. I'll put it right in the middle where the incisive papilla is and adapt. And the idea is to seal the handle margins with the tray, so when the tray is processed, it does not break or lift from the handle margin. Yeah, I will show it to you. Have a look and then we'll put it in the Q&A unit. Handle is slightly longer.
That's okay.
Yeah.
I mean,
Yeah, I can, if you think that it is under relief, you can relieve it. Yes. Yeah. So it is still not cured. this is ready, we are almost, so it has started to set. I'm going to put it in a light to mill and let it set for almost 115 seconds. That's its timer. Now I will give you material and you'll start preparing. You can use this. So,
Do one person at a time?
no, go ahead. Both of you can do it in one
Do
go.
we have that?
There are more. And be careful to keep your work order safe. Yes. Yes. Okay, first remove the excess on the land area, so that you don't stretch the impression frame, and you can go piece by piece. Yes. I'll keep this here so it does not set on you because you will be making handwork. Use it, yeah. See what you're doing? When you pull it, the tray material gets pulled. So you
Yes.
have to be careful when you're cutting it. Either you can use this. Yeah. Okay, that's good. Do you want to use this? I'll put it in the box. Remember, it has a 1 minute of setting time. Very good. Now to move it to that second mark. I know it is difficult to see, but it's just an idea. Can I have a look? Yes. You're being very careful. Okay, very good. Okay. There are other materials which we can use to make special trays. Those materials are self-cure acrylic and shellac, which is a very old material which we used to use to make special trays. But because they are not dimensionally stable, this material is much more stable as it cures very quickly in the light. Right. So you can check the fit by pushing it in, and it's a very nice passive fit. Very good. Okay, time to make handles. Okay. You can take some material from there. Okay. You can mix the material, that one, make a small round. Yes. Can I have a look? Touch it. Yeah. You've compressed it and extended the anterior border, so it will fail if it is 2 mm inside the vestibule. You have to be careful with what you have been asked to design. You can, if you're ready, you can put the tray in the light cure machine. See? Yes? Okay. Put one here. The good thing about this material is that you can, yeah,
It might be a bit overextended, actually, but I don't know whether it's about to set now. Near the fragrance.
it's just a little bit here, that's all.
Do you need to put that? Or do both are going to go together?
Both are going to go together. So it will slowly set without the light. Now because it has already been set to a shape, even if it is sitting like that, it's not going to distort. Hmm?
It's not lifting.
Just there. Yes. You put both of them like that. Put it in. Switch it on. So while it is getting cured, you can just put this inside it. Okay, we'll keep our gloves on. Okay, so
In the last video,
we're just going back to the tray design once more. The red line demarcates the deepest line or the area in the vestibule. That's the first mark, and then from the deepest area we make another line which is 2 millimeters sitting above that, short of that. So that's the extension, right? And at the back we do not move our extensions in or out. We maintain that straight line from handle notch to handle notch, crossing over or slightly behind foveal cavity. Yes? Okay. So this is a pictorial form of adapting the base or the light cure base material. So starting from the middle, adapt and try to push the air out, adapt on the vestibule, go from one side to the other. Make sure it's not lifting, do not put pressure on one side. Once that is done, then you remove excess from the outside first, then refining the 2 millimeter line and put a handle on top. So dimensions of a handle is normally it is 3 to 4 millimeters thick, and it is 8 to 10 millimeters high and 8 to 10 millimeters wide. So in case a patient is asked to swallow, if the handle is too big, the patient won't be able to swallow because they won't be able to close the mouth. So in a closed mouth technique, those small handles are desired. Yes. These handles, you cannot do closed mouth technique with this one as well. The patient has to keep their mouth open. Yes. So what will happen is once the base is cured, it will be nice and strong like this one. I'm just taking it out. Yeah. So it is dimensionally stable. Once it sets in one shape, it does not move. And then all it needs is you have to feel the margins. You have to scrape it. If you have a micromotor or a burr, then you can trim it if you want to modify the tray. Yes, the idea is not to have any sharp edges. You just scrape it. The only thing you don't do is you do not make it shorter than what dimensions you've already made. And then you check that it is passive fit, it's not dropping, and it's easily removable. So when it is placed in the patient's mouth, one, it will use less material, second, it will be stable, and third, it will not hurt the patient, and it will get the best impression of the fitting surface of the mouth. Yes, you guys can have a look. And try and remove your trays gently. You can use an instrument if you want. You can gently tease it from the side. Yes, here you can use it as well. Yes, all have inspected. Yes. Yeah. Now see where the sharp edges are. You can just gently trim. So this is refining an impression tray, so that once it's sent, it is ready to be sent. So anybody who does quality control of the work, they will come have a look at it. They will sometimes bring the caliper. They will start measuring. So this is 2 millimeters thick. That's the thickness of a impression tray, minimum thickness all around. And then they can use a scale to measure the height, the width, and the thickness of the tray handle, and go, yes, that's suitable. If they think it is too big, they will put a mark. The quality control person will put a mark saying it should be this small. So the technician has to trim that to that mark and leave it for that quality control to be checked again to be sent. Yes? So that is finishing the tray or finishing a product. Okay, can I have a look at your trays, please? So what I'm doing is I'm just moving my thumb over the margins of the tray, and very nice, very nicely fitted. Yeah, good job. Okay, let's have a look somewhere. Oh, that's a very good passive fit. Yeah, and the borders are nice. Yeah, very good here. Very good. So, another important aspect is once it is done, then you put initials of the patient's name on the tray. You remember the patient's name?
Robertson.
Jeff.
Jeff.
Jeff Robertson. So on the handle at the back, so it's not visible on the side, I would put it GF, like that. So I know that this tray belongs to this model and this model belongs to this work order in a box, in a job box. So I would like you to mark the trays.
So G for Jeff and R for Robertson. Right?
Yes,
So GR.
yes. Sometimes people write full names on the back of the model. So if there are many patients or clients with the same name or surname, they like to write the full name of the patient. Yes. So this tray is ready according to the work order to be issued to the dentist or sent to the dentist.
Do we send this work order back?
No, we keep the work order and we make an invoice according to the work order, and we send the invoice with the job. Yes, invoice would help you get money for the material you use. Well done. So we have just seen everybody's trays. So good job, everybody. Any questions at this moment? Yes? No? Okay. So, yes, go ahead.
just for like filing it down, can you also use sandpaper on this?
Yes, you can use a sandpaper if you don't have anything like a micromotor or a margin trimmer, then you can use a sandpaper. Sometimes people, I've also seen that people use nail filers. Yes. So learning outcome is learners are able to correctly read and interpret work orders. So work order. So if you get a work order, would you be able to read it, interpret it, and do the right work?
Yes.
Yes. Okay. And what all informations are important when we look at a work order?
The name of the dentist and the practice.
Yes.
The patient's name.
Yes. And the job
What the
description.
job is.
And when it is due. And if it has come with anything, impressions or models, you have to identify them, whether the model has been identified for the same person. If it is not identified, then you call the surgery that I've got a model with no name, nothing. I need information about it. And then when the dentist says yes, it's the same patient's model, then you confirm it and write patient's name on it. But normally it will come with all this information written on the model. So, okay. Learners are able to design and fabricate an impression tray. So designing part was when we designed it on the model, the extensions according to the work order,
Yes.
right? And learners are able to finish a custom tray according to the work order. So this is a finished product that you've adapted, trimmed, handled, and cured. When it comes out, you have trimmed the margins. Now it's ready to go for impression. So that's finished product, ready to go with a label of the patient's name. Yes. So learners are able to finish a custom tray as per the work order. So next session we'll do fabrication of registration rooms or bike blocks, and I will give you feedback forms. Yes, you can remove your gloves off to fill in the feedback forms. You can hand them to me. Here. Yeah, we can put it in there. Yes. All right. You have the pens. And once you fill in the feedback forms, you can hand them to me. And basically, that's it. Do ask me any questions if you have anything to ask. If I need to improve on anything or feedback or anything you want to tell me. Was this session informationally alright?
Yes.
Were you able to learn the skill?
Yes.
Would you be
Yes.
able to do it on your own?
Yes.
Yes? Alright.